Much, Chairwoman. Hey, Bob, do you know what the term hyperbolic means?
No, can you help me?
Yeah, I'm going to show you an example, actually. So, Bob, in 2020, after McKinsey's work for Purdue Pharma came to light, your firm admitted that it, quote, did not adequately acknowledge that the epidemic unfolding in our communities or terrible impact of opiate misuse and addiction on millions of families across the country. Like you did not adequately acknowledge, okay? So then the committee, of course, the great work of the committee continued their investigation and found that McKinsey didn't just fail to acknowledge the severity, but behind closed doors, your staff, your team routinely just went through this whole disregarding all the information that was coming very clearly to you all in regarding the mass poisoning in the first place. So I would like to put up an email in 2018, an email where McKinsey's government-facing practice discussed how a senior partner at McKinsey who served opiate manufacturers viewed the situation. The person wrote, quote, told me the word epidemic and or crisis are hyperbolic, okay? So Bob, this, it means marked by language that exaggerates or overstates the truth. So, fair question, Bob. More than 500,000 people in the United States have died of opiate overdoses in 1999. Do you agree, yes or no, that calling 500,000 deaths an epidemic or crisis is hyperbolic?
I'm still a little confused on the question. I think
y'all said that it was exaggerated to that you literally are saying 500,000 people. That's just an exaggeration. That it's not a crisis to have literally 500,000 people died of opiate overdose. That's what you all said in an email.
I've been clear, Congresswoman.
Okay, we have the email up.
We view it as an epidemic.
Okay. For 15 years, you all know the strategy of McKinsey, Bob, was routinely used to have sales and marketing representatives targeting doctors who wrote high numbers of prescriptions, and including those that ran so-called pill mills. I mean, to me, that's trafficking, correct? Aren't you guys trafficking?
I wouldn't say that our work on any aspect of sales and marketing is trafficking.
Yeah, I know you all wear suits and everything, and you don't consider yourself drug traffickers, but let me give you some information here. When the FDA announced new restrictions on opiates in 2013, including a, quote, boxed warning for pregnant women, McKinsey consultants at Purdue had doubts that this warning would even change the behavior of high-prescribing doctors and emailed each other about the safety concerns. So I'd like to put one such email up on the screen. So Laura, on your team, she's a principal at the firm, she said, I'm most curious to see if high writers even notice this smiley face. So Bob, I think it's safe to assume that, quote, high writers were refers to prescribers that were writing high numbers of prescriptions for opiates. Would you agree?
If you can give me a second just to read the email, Congresswoman. I just see it up on the screen here.
I mean, those were the exact prescribers McKinsey was advising Purdue to target, correct? In order to turbocharge sales?
Well, from my understanding, this email chain refers to how we could help Purdue comply with new FDA restrictions. I completely agree that a smiley face is totally inappropriate.
Yeah. Well, you guys are trafficking. You're making money off of poisoning people. So why do you think your employee, you think it's fun, why do you think your employee would even put a smiley face next to a question of whether or not high writers would notice a black box warning, literally a warning, had been put on the Oxycontin for pregnant women?
I can't guess as to why there was a smiley face. I do know this string relates to how we help Purdue comply with new FDA regulations.
No, y'all were happy to think that this warning wasn't going to derail McKinsey's pill-pushing schemes, trafficking the drugs. While McKinsey was celebrating its blood money, communities were being torn apart. Bob, 86% of overdoses in my district, in the city of Detroit, were due to overdoses from opiate. Did you know that?
I did not know.
Do you know behind that number was a human being, Bob? Do you understand? Like, if anyone could explain me the difference between McKinsey, Big Pharma, opiate cartel, and the organizations of people like Pablo Escobar, I'm all ears. I really am. Y'all may be wearing suits and you may be having these fancy offices, but you're doing the same freaking thing. Thank you so much. I yield.
Will the lady yield?